Good afternoon, everyone. I'd like to call this meeting of the Board of Health to order. Donna Strong, my name is Thomas Corey, Dr. Daniel Souza, Tess Curran, the agent for the board. Pursuant to the open meeting law, any person may make an audio or video recording of this public meeting or may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived by those present, and are deemed acknowledged and permissible. We need to approve the minutes of the meeting from January 29th. Are there any additions, deletions, or corrections to be made to the minutes of the meeting as printed? Do we have a motion?
I make a motion to accept the minutes of the meeting from February 27th, from January 29th.
And a second?
I'll second.
All in favor say aye.
Aye.
Opposed, so voted. Todd, if you'll come on down with Mr. Gonzalez and Roger. Todd, welcome back.
Oh, yeah.
Gentlemen, if you state your name and address for the records.
Todd Bancourt, 301 Bogamash Road, Tiverton.
Alvin Gonzalez, 279 Colette Street, New Bedford, Mass.
Roger Casaman, Inspectional Services, City of Fall River.
Okay. Roger, is all the paperwork?
As far as I can see, all the paperwork is here. I just gave you another sheet on the training aspect of it. And all his training has been done. He's actually got his skin training, which he didn't really need, but he's got it already.
I saw that.
Yeah.
Okay, so what do you recommend, Roger?
I recommend he has start his apprenticeship.
Okay. Todd, you're all set to apprentice him for a year?
Oh, yeah.
Okay. Would you like to say anything, sir?
I'm all
You're
set.
ready to get going?
Ready, all set.
Okay. We have a motion to grant the apprentice license to Mr. Gonzalez.
I will make a motion to grant the apprenticeship for body art to Mr. Gonzalez.
I second that motion.
All in favor say aye.
Aye.
Opposed? So voted. Congratulations.
All right, thank you.
Thank you.
Okay, next item, we have Cheryl Sabara, is that correct?
That would be me.
Cheryl, please. Take the guest chair.
Thank you.
They were in the hot seat, you're in the guest chair. Okay, you're going to provide us some information about possible regulations.
Yes, I was asked to come and speak with the board about what local boards of health can potentially regulate relative to adult use cannabis. And the cannabis law, it's called the law that makes adult use cannabis legal is a state law, but the law is not preemptive, which means cities and towns can further regulate cannabis in a way that doesn't conflict with the state law. So there are certain things that cities and towns can consider doing. They don't need to do it because the state law is by law enforced by the Cannabis Control Commission. However, some boards have indicated that they would like to do some things that are not in the state law. For instance, one of the issues with the state law is that the state law defines marijuana accessories as any possible item that can be used to ingest marijuana. It includes items that are illegal pursuant to Chapter 90, Section C, 94, Section C, which is the drug paraphernalia law. So we've got a conflict now. We've got a law that says these things are illegal because they're drug paraphernalia, things like bongs and pipes and anything where you could either smoke or vape or ingest marijuana. Now those are considered legal marijuana accessories. So there's a conflict between the two laws. The way we used to handle those things that look like drug paraphernalia, we used to say because arguably they can also be used to ingest tobacco, for instance, either vaping or smoking, you would need a tobacco sales permit in order to sell those items. So that would at least limit the availability of those items to establishments that had a tobacco sales permit. We can no longer do that. Now these items can be sold without a tobacco sales permit because they are legal marijuana accessories. What some cities and towns are doing, because they're seeing a real increase in the amount of these items and places where these items are being sold, for instance, convenience stores, restaurants, different places, is that they're limiting the sale of marijuana accessories to marijuana establishments and to adult-only retail tobacco stores. So it's a way to limit where these products can be sold. Again, they're age-restricted products. So that's one local law that some cities and towns are implementing. Another one is the state law specifically says that edible marijuana products are not considered food for the purposes of this law. I know it's a hard leap to say an edible, which by definition is something that you can eat or drink, is not food. But that is what the law says. And the intent behind that, and it was the same for medical marijuana. We have the exact same situation for medical marijuana. The intent was to prevent local health departments from having to enforce the food code. What the food code states is that local boards of health enforce it, and part of the enforcement is to issue a local food service permit, to do inspections, periodic and complaint driven, and to make sure that good manufacturing practices are taking place, and making sure that the conditions in the establishments themselves are sanitary and in keeping with the food code. Because the state says that these products are not food, it enables health departments to keep their hands off, if they want to, of these establishments. They don't need to inspect them. Some boards of health don't feel comfortable with that and want to inspect these establishments. Right now, without a local regulation, the only entity that can enforce the food code is the Cannabis Control Commission. They do have state inspectors. State inspectors have gone out. You may have heard that there have been some establishments that have been shut down because of concerns about the purity of the product itself. So there are some concerns that health departments feel. This is something else that boards of health can do locally. They can incorporate the food code into a local adult use cannabis regulation, thereby and then would have the legal authority and actually the obligation to enforce the food code in these establishments. Another possibility is to issue an operating permit so that you would know where these places are in the city, and you would have the ability to either suspend or revoke, depending on if you find a problem in these establishments. That's another local option that you could have. Another one would be to do local compliance checks to make sure that no one under the age of 21 is permitted to enter, and to make sure everything is in order in the store itself. Right now, the state Cannabis Control Commission is the only entity that does have the authority to do compliance checks, similar to tobacco compliance checks. So those are some and you can set the hours of operation. That may be something that's already been done by another municipal department. I'm not certain. but that would be something that the Board of Health could also do. And there's another issue that's beginning to arise. We're seeing it. A lot of our tobacco control programs are seeing it. I don't know if Maryland has seen it here or not, but there is a slight, I don't want to call it a loophole. I'll let you decide what it is or isn't, but the state law does not prohibit the gifting of marijuana. And what we are seeing now in some vape stores, and I just became aware of this a few days ago with another tobacco control program director, where a retailer, a vape store retailer, if a purchaser comes in and purchases a battery for a vape product, they are gifted with a bud of marijuana. As long as it's under an ounce, you can gift marijuana. You could limit that to, you could prohibit the commercial gifting of a product or the commercial sampling, whatever you want to call it, but without a local regulation that prohibits that, this can happen because the law didn't address it. I think that in a future legislative session they'll probably amend that to cover it. But right now, any store could gift a small amount of marijuana if a person purchased something else, which is a little bit which is a little frightening that could happen, but it could, unless you pass a local regulation that would prohibit the commercial gifting. This would still mean a person could give to another person socially, but not commercially.
Let me throw out a ridiculous situation here. It's Mardi Gras next week. Normally, I would have coffee and donuts for Mardi Gras. If I wanted to gift these buds for Mardi Gras, I could?
Yes. Yes. You could individually, you could, and you could also, if you were a business giving out or selling Mardi Gras necklaces or whatever. Yes, in Massachusetts, you could gift a small amount of marijuana pursuant to the state law.
But you don't have a license to sell marijuana.
That was gonna, that's why I had my hand up.
It doesn't matter. You're not selling it. You're giving it.
But you're gifting.
I really think this is,
Another whole situation.
that's another whole situation where you got it, but it's gifting it, because that was my gut reaction was, oh, this isn't a problem. But they're not selling it. They're giving it away.
And it has to be to someone over 21, they're giving it away, right?
Yes.
Who's gonna check that?
Yeah.
I mean, that's why I drafted this. I was the lead drafter of this, but I did it with other colleagues. And this was actually an attorney from the Boston Public Health Commission was the one who brought this to my attention and said, we should at least put in no commercial gifting. So, and that can be done locally, and that solves.
That's what I'm already leaning towards.
That solves that.
I don't know about the rest yet.
That's a pretty simple.
That one I'm pretty close to
Yeah.
leaning
So I don't know if you've seen it. It was Maureen Busby
Yeah, I know.
that has seen this, and Joyce Redford and some other folks. And you could also do. You can do buffer zones. There shall not be establishment within X number of feet from a school. That's in the state law, but you can't increase the buffer zone, but you can put it in locally so that you could at least locally do the enforcing of it. So those are the main, and you could do no coupon redemption as well. I would assume at one point we will see coupons, so those are the issues that you could address if you wanted to through a local Board of Health regulation. Mainly the issues, well, I think you got the gifting, the food, the compliance checks. I think those are the bigger ones. And then if you want to open up the whole can of worms relative to CBD, I'm happy to address that as well. CBD is different than cannabis because it is not cannabis. It's a hemp-derived product. There's a question now whether it's all hemp-derived or whether some of it comes from a flower. But from my understanding and experience from speaking with hemp farmers, that's really not what the issue is. It's wherever it comes from, it still has less than 3% THC and is non-hallucinatory. And some people feel very strongly that it is a positive addition to the herbs that are around that help people. There's more and more press reports and other reports that indicate that it's not, in quotes, very dangerous, and it's being sold in lots of different places. You may know now that federally it has been taken off the Schedule I illicit drug list and is now legal pursuant to the DEA. However, it is still subject to regulation by the FDA because it is still an additive. If you're looking at edibles, it is not an approved additive right now from the FDA. It is also not an approved dietary supplement. So one needs to be very careful when one sells CBD that you're not representing that it has some medical value or health value, because that is, in order to make those claims, it needs to be approved by, I'm speaking to someone who knows way more about this than I do, but it has to be approved by the FDA as an additive.
Can I?
Yes.
So we do have an establishment that's selling bath and body products with CBD.
Mhm.
So, just as a quick question, so if we go, there's the FDA and the Department of Agriculture will be doing compliance checks to that establishment.
Supposedly.
Okay.
Yes.
And then if I guess if we were to walk in and see that they're touting health, improvements or anything like that, then we refer that to the FDA?
Yes, you would refer that to the FDA. The Department of Agricultural Resources is the agency that's in charge of drafting regulations for hemp and CBD products. They have not done so yet. They have a policy, if you go to their website, that requires a license for anyone who is growing or producing any hemp-derived products or hemp. So someone in Massachusetts who's doing that needs to get a license, and the license just says this is your license until such time as MDR actually enacts regulations. So what the concern becomes the edibles, the CBD edibles then becomes a concern. And what I've been suggesting, and again, I'm not your city solicitor, your legal advice comes from your city solicitor's office. I can only provide legal education and technical assistance, but we are suggesting, when boards have come to me and said, what do I do? I'm finding coffee shops that are selling CBD-infused teas and CBD gummy bears and this, that, and the other thing. One thing would be just to let them know that they are still subject to FDA regulations. And if they're selling an edible that has an additive that has not been approved by the FDA, they can be reported for doing so. The FDA is sort of in a flux over what to do with this now as well. They are taking a stand. Just recently, Commissioner Gottlieb, and I can email it, Tess, to you, issued a press release saying that it's still, you can't make these claims that this is a health product and you can't add this to food. However, they're taking the stand that they're not going to spend their resources chasing this right now, that there are other things that are more pressing. But again, it's a risk assessment that a retailer has to make. What some health departments are doing is requiring that if someone is selling a CBD-infused food product, that they have to demonstrate that the CBD was tested by an independent lab, and they need to be aware that this is an issue for the FDA. Brookline did put out a memo. I can send that to you as well, Tess, which is just an idea of something that you could do to, address this issue. Another thing you could do locally is to at least age restrict edible CBD products, and require that they be behind the counter. We're getting parents complaining, and actually one city councilor in Medford's grandson, I think, got a hold of these, but the CBD infused gummy bears are right out where the candy is. And if you could put those behind the counter, do some of the tobacco control strategies that we do, no self-service, those kinds of things that might help. But age restrict them and put them somewhere. I'm hearing anecdotally that a lot of CBD retailers, the ones that are trying to do the right thing, are already doing that. They're either in cases, and they're not seeing so many gummy bears. They're seeing more lotions and with no health effect claims on them. So
as I see it, there's like 6 issues to address here, and as you went through the issues, they're actually easier going backwards. Because I would start from the bottom up. So I would say for the 6th issue, which is to age restrict CBD to over 21
For sale.
for sale, and having it behind the counter, I think that's reasonable, and it's a safety issue. It's a public health issue.
And I should let you know that the person that suggested that to me was one of the Cannabis Control Commissioners.
So I think I think we're all going to be a thumbs up for that one. Then when it comes to the distribution of commercial gifting, that's a loophole that can open up a hornet's nest. So I think, if I may speak for the board, that I think we'd all be behind the banning of commercial gifting of tetrahydrocannabis, THC products.
Correct.
I think that's...
I think the whole universe would be for that.
Now it gets a little trickier with the compliance checks, because that's going to require resources.
Yes.
And do we have the resources to do this? As far as the Cannabis Compliance Commission, what's their manpower like? They must be stretched pretty thin already.
They are. Right now, when the whole industry gets up and running, that may change. I could talk to you for days about that, but I won't. If you're interested in what the landscape looks like, if you just go to the Cannabis Control Commission's website, they have a wealth of information, including PowerPoint presentations that staff has done that go through where these establishments are, who owns them, are we really encouraging minority-owned businesses, or just what the status is. And it's very interesting information, but they don't have a lot of inspectors. But you're right, who is going to pay for this? And I'm speculating now, but I would not be surprised if we end up seeing some sort of grants coming from the commission to locals to do some of this work somewhere down the line.
It's got to be coming from the revenue that the
Exactly.
generating the tax.
Exactly.
20% or something.
It's it's 20% in total. So that, I would think that would be one strategy that may be looked at. Also, there may be training coming from the commission to locals. I would hope that when a city is looking at entering into an agreement, that those things will be considered, these public health kind of strategies that are going to need money, and this will be written into an agreement with an applicant that may be coming to the city. You could also look at an operating permit and putting a fee that, if city council approves it, could go into some sort of a revolving fund for the health department. Again, that you would have to have an enabling ordinance that would allow you to do that. But you're right. I mean, we walk a tight line here between wanting to protect public health and having the resources to do it. To actually do it, and when we don't want to enact a regulation that we can't enforce. So maybe Doctor, you do the low-hanging fruit that isn't going to cost a lot of money to enforce now, and you keep an eye on things and see where they go. Brookline is a pretty well-resourced health department. So is Needham. So are some of the ones that are looking at putting in all of Arlington. Actually, just a few months ago, put into effect a pretty comprehensive regulation. So yeah, I mean, I don't have a good answer for the resources that would be necessary to do these inspections.
No?
I have a question. Cheryl, if the board decides that they want to do some type of regulations, do you have the samples? Do you have the
I
draft?
do. I have a draft. It's on my website, which you can find. I'm in the process of updating it, though, because I haven't addressed the CBD pieces yet. And now that medical marijuana has been completely transferred over to the Cannabis Control Commission, I need to change some of the citations in it. But you can get a good feel by just looking at what's on our website, how it could look.
I'll send that to each of you after.
Okay.
Yeah.
And as far as Fall River goes, we have one dispensary right now for both medical and recreation.
Yeah, co-located.
Co-located in,
That's what it's called, a co-located establishment, because you've got
Right,
medical
okay, gotcha.
and adult use.
so that's the one that we would focus on.
Yeah.
And we have the ability to ask for an operating permit for that.
You do have the legal authority to require one. They're going through this in New Bedford right now. And again, it can be you, or it might be another municipal department that would, it could be a permit from the clerk's office. I mean, there could be lots of ways of doing it. I like it being a Board of Health permit, because I think it gives you, it's similar to a tobacco sales permit.
Access,
Yeah, exactly.
inspection,
Right.
and even the edible.
Well,
food.
in a food service permit gives you access as well.
Where is that one place, do you know?
Very
It's on
close to my
William
house.
Canning Boulevard.
Is
It's
it?
on William Canning Boulevard, just before where Heritage Liquors used to be.
Yeah.
That's the place.
It's in that building.
Near the Tiverton Casino.
Yes.
So you can get all that one stop shopping.
Mm-hmm.
No, and the other thing is limiting the paraphernalia to establishments that service THC. I think.
Yeah.
But what's the general consensus amongst the people that you've talked to?
That is one that's very popular, because in the municipalities that are seeing a rise in these paraphernalia kind of products being sold, I don't know, you probably know better than I do,
Everywhere.
everywhere. So
You're not gonna find them at Cumberland Farms. You're not gonna find them at Speedway. But every
Small.
other small mom and pop store, gas station, convenience store, they're out, it's everywhere. And as you all are aware, back in 2007, the police departments in all of the local communities were enforcing that Mass General Law 94C, and you couldn't buy that stuff anywhere around here. And the treatment centers would continually tell us that their clients would come in complaining that they couldn't find what they needed to smoke their crack, to do whatever they needed to do, which was a great thing, I think. I mean, if you're gonna try to do something about the problem, you need to limit the access to what they need. And since the regulation went past into law with the recreational use, none of the police departments are enforcing that because now they're all legal under the regulation as marijuana smoking accessories.
And some police don't understand the gifting issue either. We have had police departments say, I can't do anything with it.
Yeah, that's just.
They just don't, you know, and that's not, the Cannabis Control Commission is telling them that wasn't the intent. No, that's not legal. But it actually, it is.
Shouldn't be, but
It shouldn't be, but it was an unintended consequence
So
of the law.
if we limited it to the places that sell marijuana, it would only be that one place?
You would just prohibit all gifting in marijuana. You would limit the accessories to adult-only retail tobacco stores.
Okay, so the convenience stores could do it.
No, because they're not
not
adult-only. Adult-only tobacco
Like the
retail
tobacco shops,
stores
the actual
So,
tobacco shops.
do not allow anyone under the age of 21 to enter.
So a vape store.
Okay.
We've got a head shop that sells very little tobacco. All they sell is that type of product. We have one of those. We have probably 6 adult-only retail tobacco stores right now. We have to be 21 to enter. They don't sell food. They're just.
So it'll be 6 plus this one dispensary?
Correct.
I'd be for that.
Right now, but then how many licenses are we waiting for? For dispensaries and retail? 6, 7 more
Really?
There's a-
in the city?
So we gotta get on top of
Yeah.
it. Now let me ask you a hypothetical.
Sure.
So there's a dispensary with THC product in edibles, and they have a batch of cookies that's contaminated with salmonella or staph, and there's a food outbreak. Who's responsible for cleaning up the mess? Does it fall on the Cannabis Control Commission?
Yes. Right now, it falls on the Cannabis
And they don't
Control.
have the experience to deal with food-related issues.
No, and they have been working in collaboration with the Department of Public Health on this specific issue, but ultimately the buck stops with the Cannabis Control Commission. Now, the good news, well, the encouraging news is that on the medical marijuana side, we do have some experience. We have several years of experience worth of dealing with food on that side of the equation. So we haven't lost that. I think a lot of the medical marijuana program staff that was at DPH has transitioned over to the Cannabis Control Commission. So there's some institutional knowledge, limited, about addressing contaminated THC-infused food, but not a lot. And yeah, right now, the buck stops with them.
And if the board were to decide to put a food code regulation in, it would fall, the responsibility if there's an outbreak would fall on our local?
On the local and the state. They'd work in collaboration, which is what they do whenever there is a significant outbreak of any
That's
kind.
retail.
Yeah.
Cheryl, is the Cannabis Control Commission moving toward restricting where the paraphernalia is sold?
No, that's a local, it's not in their regulations, and they're not gonna be opening up the regulations anytime soon.
Okay. So if the board was looking at restricting where those products could be sold, and we have 80% of our retailers are selling those products, what kind of a timeline would you suggest?
I would defer to the experts that do this kind of work. I mean, at least 60 days.
Okay.
I would think you'd want to give them a chance to either sell them down or dispose of them somehow, I would think.
And I have a question about packaging. I know I believe in the regulation the blank regulation on your website, there was a mention of packaging and not I guess either be edibles or other items come in the original packaging and not be
Oh, absolutely.
So could you maybe talk to the board about that? as well?
Sure, it's sort of, and this is in the state regulation as well, that items have to be sold in their original packaging as single-serve items. If there are multiple servings in one package, has to be clearly indicated that, for instance, if I use the analogy of a Kit Kat bar. You know, if you're putting multiple servings in one package, like a package of potato chips or whatever, it has to be clear what a single serving actually is. In some states, they will sell a cookie, and I'm just remember one being a cannabis snickerdoodle cookie, and it comes in a cookie size like this, and if you look at the package says this cookie is 6 servings. Well, I don't know about you, but I just bought cookies at the New Boston Bakery, and they were this big, and 6 people aren't eating that cookie. When I get home, I'm having that cookie. So what the state now requires is that at least it's designated, like a Hershey bar or a Kit Kat. It doesn't mean someone may not eat more than one, but at least there's a designation that this cookie is 6 servings.
We had the same issue with the Lazy Cake brownies years ago, where one brownie the size of a Little Debbie snack cake was 2 servings. And kids were eating them and falling asleep at the wheel because it was a melatonin brownie. Till the FDA finally got rid of them.
All right. So, how do we want to break this down?
Did you finish your 6 things?
Well, we talked about the limitation on the paraphernalia to only adult-only tobacco and the dispensary.
Right.
We talked about the operating permit for food inspection. We talked about local compliance checks, having the authority to do that. Banning the commercial gifting of these products. Restricting the use of CBD products to 21 and over only, and keeping those products behind the counter for safety.
The edibles.
The edibles. The edibles. Did I
That's
miss
fine.
anything else? It was the food code issue.
Yeah.
Yeah, that was 6.
Yeah. That one I'm not clear on. That's a big one to take on.
It is, because it does clearly involve resources and time and issuing permits and... But again, how many, and I don't know how many establishments we're actually going to be talking about in Fall River.
I think that one need a little bit more time and getting a feel for what the other...
And whether they're going to be selling edibles or not is another issue. Because there are strict requirements, state requirements on the cannabis retailer that's selling food products.
But they're not considered food products, right?
Not for the purposes of locals.
And so if we get a call in terms of, and we, meaning the health department gets a call that there's mold on a cookie at, a retailer, and we don't have anything in place locally, then we would again refer that to the cannabis.
You would. I mean, you could try to go in and get some evidence to, as long as they let you in, to, take photos or whatever so that you can pass it on to the Cannabis Control Commission. But yeah, they would be.
That's why we need the ordinance.
Right.
Right. So that they have to pass.
Right. Okay, thank you.
Yes.
You're
thank you
welcome.
very
Sir,
much.
before you leave,
Sure.
could you talk to the board about the recreational smoking facility that we talked about last year?
Yes. There was an issue that came up at the New Bedford Board of Health meeting last night where an individual was trying to get a variance from the board's regulation that prohibits smoking in smoking bars. He wanted to open up a smoking bar. And what came up was he was bringing up the issue of the fact that because adult use cannabis is now legal, there will be people smoking adult use cannabis in these smoking establishments. And that was just going to happen because New Bedford voted to permit marijuana establishments, and that's just not true. Right now, in Massachusetts, there is no place that you can smoke cannabis. Our state law prohibits the public consumption of cannabis, which includes smoking, ingesting, whatever, in any public place, which includes any restaurant, bar, outside, indoors, anywhere. What the law also includes is a section that permits municipalities to affirmatively vote for places that would permit the social consumption of cannabis. It's a very proactive, in order to permit a place that would permit some sort of use of cannabis, the voters would have to vote at a biennial election. So the next one is what? This coming November, right, and then 2 years after that. There would have to be a ballot question put on at the biennial election, and the voters would have to vote to permit that to come into the town. So number one, that would have to happen before any social consumption establishment could open in a city or town. Number two, the Cannabis Control Commission has appointed a smoking committee to look at what those places should actually look like. I am one of the members of that committee. And we are, and the other members are employment lawyers, scientists, a physician who specializes in cannabis, and me as the public health lawyer. And what we seem to be coming down, we're very concerned about the social norming aspect of permitting combustible cannabis in any establishment. You know, our kids haven't seen it, and all of a sudden, even if they're adult only, I don't care. It's still gonna normalize, or could still normalize smoking.
And why should somebody who's non-smoker or whatever be subject to having to inhale?
Right, and so the recommendations that we might be made, we haven't we don't have a general consensus on this, but this is the way we are going. Our recommendation is probably going to be, if your city or town permits social consumption, it cannot be combustible social consumption. We just can't see opening up that can of worms again. So it may be edibles, it may be vaping, it may be something, but there was a real concern from the employment lawyers about liability issues for that. Lots of concern, whether or not the person volunteered to work there or not. There was a problem, there was a question about secondhand exposure and, you know, do you go into work and you're fine and then do you leave a little high? You know, all of these kinds.
Driving and you're under that.
Yeah, so there were all sorts of concerns.
It took us so long to get smoking out.
I
Why
know.
do we want to go back into
So,
that?
but we don't know, that's just a recommendation that we would be making. It's up to the Cannabis Control Commission. They're supposed to be considering it right around now.
Nothing to do right now.
Nothing.
Just to
No
reinforce the
one,
law as it stands.
there should be no commercial establishment in any city or town in Massachusetts that permits the smoking of cannabis right now.
And as far as I was concerned, and if you could just confirm this, that retailers, recreational retailers are not able to also have if this were to move forward, a smoking establishment co-located.
Correct.
It's not, you
Correct.
can't buy it and then smoke it on scene.
Correct. That would have to be a place for social consumption. And there's another thing in this regulation that we didn't talk about, and that is also to prohibit the sale of tobacco in a marijuana establishment and to prohibit the sale of alcohol in a marijuana establishment. In other words, to make them real, like adult-only retail tobacco stores, they're adult-only retail cannabis stores. That's it, nothing else in the store.
And I have one additional question. So, our department has been getting complaints about, apartments or, places and their neighbors are smoking, and it's impacting their health or their children's health. And I'm wondering what, if anything, can be done about that.
I am going to refer you to Chris Banthen, who is a colleague of mine who works with the Public Health Advocacy Institute and works on smoking in multi-unit dwellings. And this is one of the concerns that some folks who do a lot of work in racial equity have, is that the HUD, the Housing and Urban Development Agency of the federal government, and many states, many cities and towns have not regulations, but they have policies in public housing that prohibit smoking. That's smoking. That's not just tobacco, it's combustibles. So if that's happening, number one, it could be a violation of the policy of that housing development, and a violation of federal law as well if they're permitting smoking. So that would be something, and I would refer you to Chris because he can give you some really good, and Marilyn, you can just give him Chris's.
The last complaint we got, it wasn't for public housing, because when we get the complaints from people who are in public housing, then I work with the housing authority to address those complaints, whether it's smoking cigarettes or smoking marijuana.
Yeah, I've gotten enough.
But the last complaint we got last week was private housing, and I did refer the tenant to Chris, and Chris emailed him back, and they already have an appointment to have a phone conversation.
Yeah, I mean, it's the same problem, tobacco and cannabis, when it comes to combustible.
Okay. We certainly thank you for your time today.
Oh, anytime.
This is something to think about, very informative, yes.
This is the tip of the iceberg.
Yes, it is. And it's a lot of lessons learned, it's new to everybody.
Okay,
Thank you
very
so
much.
much.
So as long as we take our cue from tobacco, we'll be all set.
Marilyn, you have an update for us.
I do. It's actually a positive update, so.
Well, Tessa's going to get us a copy, she's going to get the website for us, so we can do some investigating and then reading on our own.
Next
then
meeting,
yeah,
we will
actually-
create
Yeah, Cheryl, would you recommend if the board were to decide to move forward on any regulations that we have an open meeting,
A public hearing.
public hearing prior to the vote like we did? for the
Yes,
tobacco? So
even
that
though
would be
there's no
nice.
legal requirement, how on earth can you get buy-in from your municipality if you don't allow the public an opportunity to hear what you're thinking?
So in the
And I'm happy to assist in drafting anything.
So we can come up with a draft, forward it to you.
Or what you could also do is you could come up with what the bullet points are, which I
Yeah.
think I know, but you could,
Yeah.
when you have further discussion, and then I can draft it based on those bullet points, and then you can let the city solicitor look at it.
That'd be great.
So maybe after Marilyn does her presentation, then you can discuss the bullets, and then I can jot it down, and then I'll.
You can email it to me.
Okay.
Yep.
Okay. The one thing I can tell you right up front is it won't be me doing marijuana compliance checks, ever, and not happening. I'm trying to get out, not get more. So, tobacco violations. The last round of compliance checks where we had numerous violations was in October of 2018. Since that time, all of those retailers have been rechecked and with no violations. Our SINAR checks, which are assigned by the state, are under federal guideline for Marlboros and Newports, and they are assigned either by town for small towns or zip code for cities. And those were done this past Friday. In the 02720 was our only assignment for Fall River, and there were no violations. And we have 2 new stores. One is an adult-only retail tobacco store, and one is a convenience store that we're hoping to open in February and have since delayed, so they're hoping to open now in March. One of them is going to be on Quarry Street, the other one is way down on North Main Street, down near where the old veterinary office used to be, way down, on the way to Shores, like way down that way.
Down my area.
Down your area. And from what I understand, for that particular store owner, that would be his 4th store. The neighborhood association is trying to block him at zoning. They don't want a store there. So, but that's it. Everything's good so far. I haven't signed my retirement papers yet. I'll let you know before I do. Won't be long, but I know Tess doesn't want to hear it, but it is what it is. Do you have any questions for me about process?
No, sounds like things are going well after all these years.
It's about time. Yeah, I mean, things are going well. And, I mean, we could have used a 20-year-old when we did those checks, but we used a almost 18-year-old, and there was still no sales. But yeah, now we can use up to 20. So a lot of our kids who had aged out, we've been calling back, and they're very excited to keep going. So, that's it.
Thank you.
They do. They get $12 an hour cash on the day they work. And it looks great on a resume. And I can tell you that the majority of the kids that have worked for us, going all the way back to 2004, have gone on to criminal justice. Gone to college for criminal justice. A lot of our kids.
That's pretty cool.
Yeah, it's very cool. And until now, until the age changed to purchase tobacco, once they turned 18, we brought them over to the police department, and then they did alcohol checks from 18 to 20 with the police departments. Not just here, but all the surrounding communities. So,
Really cool.
okay?
Thank you.
Alrighty.
Okay, so getting back to the marijuana, we want to go through Dr. Souza's list.
Sure.
I'm agreeable with all of those.
So bullet point 1 will be to limit the sale of cannabis paraphernalia to only the dispensaries and adult-only tobacco stores. To issue operating, bullet point number 2 is to issue operating permits to the dispensaries, which then allows the board to have the authority to inspect for sanitary and
Revoke, shut down.
revoke, shut down if they don't meet the criteria for safe sanitary food sale. That also will give us the authority for local compliance checks of those facilities.
And just as a note on that, so, the resources for that, unfortunately, within our budget I don't have the funds to, hire someone to do those compliance checks, but I am monitoring, any type of grants that will become available, and then I'll be sure to apply to those, grants. So just as a sidebar, that's something that I have been, looking.
And that's something too that has to be addressed with the city council in terms of where the tax revenue is going.
Mm-hmm, right.
'Cause-
Well, if there's 20% tax on this, give us some of it to
Right.
regulate it.
Right. And then we would ban the commercial gifting of cannabis products, tetrahydrocannabis, THC. We would restrict the sale of CBD products to the age of 21 and over, and have these products be maintained behind the counter where they're not accessible.
Now, I'm just going to throw this thought out. In a conversation with some pharmacy board inspectors and some members of the State Board of Pharmacy, pharmacies would be allowed to have CBD oil in the store, but not behind the counter in the pharmacy. And it was absolutely forbidden to do any compounding with CBD. So in the pharmacy, we could have it out front if you so decided, but it could not be, and they just find the pharmacy is from the cash register back, okay, to get a picture of pharmacy. It had to be out front,
Where anybody could pick it up.
where anybody could, well, from what I have seen of the packaging stuff, they're all very small packages, so they're sort of in these plexiglass clear cases which are locked.
Locked.
Oh.
Yeah,
So they have to ask for it.
they have to ask for it, yes.
Well, that's the other piece of that, because no self-service. If they're
Mhm.
behind the counter or locked in a cabinet, as long as it's no self-service.
Yes.
I would throw that in there.
Yes.
But how many pharmacies are actually interested in this? Like, are the big retail chains interested in this? The smaller ones?
Mine are not, but
Okay.
I can't speak for the whole industry.
But if no self-service would cover that, because they'd be locked in a cabinet.
Yes.
And then we had also discussed the packaging inserts stating that it's in the individual.
Yeah, but I think that sounded like
That's
it was
not-
actually covered under, I was under the impression that that wasn't covered under the state regulation, but it appears to be so according to Cheryl. So I think that would be off the table.
And then the
So-
final thing is just to reinforce that no commercial establishment will allow smoking or use of any combustible of THC. Did I get it all?
I think so.
And just, I had a note, do you, would you be interested in doing any type of add-on for no coupon redemptions?
Yes.
Okay, so I can try entitlements. Okay. So I'm just gonna read it back to you so that I make sure I have it covered. So, limiting the sale of accessories, to marijuana retailers and adult-only tobacco establishments, enforcing an operating permit or operating license so that we have the capability of, checking and making sure they're up to par. Compliance checks, although I might think of holding off on that. If, like Cheryl said, if you add something that we're not able to do or enforce,
We don't have to tell them.
okay. All right, so we'll just keep it and then we can vote on it.
But it gives us leeway if there was
Right.
an incident,
Where there's,
Right.
sure,
you
okay.
could go.
I would
Okay.
put it in.
Okay. Ban commercial gifting, restrict the sale of CBD edibles to individuals under 21, and no, and
Over
add in-
21.
I'm sorry, oh my gosh. Over 21, and require no self-service, the no smoking establishments, and then no coupon redemption. Okay, so what I will do is, after this meeting wraps up, I'll be sure to send you the information that Cheryl has on her website, and it has kind of an outline of most of all the things that she spoke about, and then it will have, the pieces that we're adding as well. And then I'll share this, these 7 items with Cheryl, and then she'll be able to draft something up for us, and then at our next meeting, which is in March, it will be, a public hearing.
Now,
So-
will it go to the legal department before or after a public hearing? Because she said it would need, what she
Yeah,
drafts up would need to go to the city's legal department.
I will have to speak with our corporate counsel prior to, so I'll get this to Cheryl today, and wait to hear back from her, speak with Judge Macy, and then, if I have any updates or changes, then I'll reach out to all of you individually, and then we'll go from there.
It is really scary that if we don't put any of that into place, what could happen? I mean, it's scary what's gonna happen
The
anyway.
pendulum can swing the other way really quickly.
Yeah. That's why I said I can't even imagine why you would go back to letting people smoke this.
Yeah. Okay.
Okay? And
And for the
if any
next-
changes or anything, just reach out to me.
Okay. The next meeting, I think we had tentatively scheduled for March 26th. Is that still good? It's a Tuesday.
That still works for me.
Works for me.
Me too.
Okay, we're going to March 26th, 1 o'clock.
Yep, works for me.
Okay. Tess, is there any other business for the agenda of such a nature that it could not come before the board make the regular agenda?
No new business.
Okay, do we have a motion to adjourn?
I make a motion to adjourn this meeting.
I'll second that.
All in favor, say aye.
Aye.
Opposed, so voted, thank you all.
Very busy meeting.